What is the secret language of medical coding denials? Imagine trying to decode a secret message that explains why your insurance didn't pay for a service. That's what the secret language of medical coding denials is all about. When insurance companies refuse to cover a claim, they send a notice with specific codes and terms. These codes are called claim adjustment reason codes and remittance advice remarking codes. They tell providers and patients why the claim was denied or paid differently. Every denial has a reason behind it. It could be because the service was not authorized beforehand, the patient was not eligible at the time, or the service was not considered medically necessary. For example, if a claim is denied because the patient was not covered, the denial might include a code like CO4, which means the procedure code does not match the modifier used. If the issue is missing authorization, the code might be CO15, indicating the authorization number was missing or invalid. Understanding these codes helps seniors and their advocates when they want to appeal a denial. For instance, if a service is denied because it is not covered under the plan, the appeal should include proof that the service is medically necessary. This could be detailed medical records or a letter from the healthcare provider. Some common reasons for denials include issues like missing or incorrect claim data, services deemed not medically necessary, or billing errors like upcoding or unbundling. Upcoding is billing for a more expensive service than what was actually provided, while unbundling involves billing separately for services that should be combined. These errors can trigger denial codes such as CO50, which indicates a non-covered service or lack of medical necessity. For seniors using Medicare or Medicare Advantage Plans, understanding these codes is especially important. These plans often requiring prior authorization for certain services, and documentation must clearly show medical necessity. If a claim is denied, the code helps identify what needs to be fixed or explained in the appeal. Appealing a denial involves reviewing the notice carefully to find the denial code and reason. Then, gather all supporting documents like medical records, provider notes, and policy references. Follow the instructions on the denial letter to file the appeal within the specified time frame, usually between 60 and 120 days. Sometimes, denials are related to age-specific issues, such as billing for pediatric services for a senior patient. In these cases, the denial code might point out that the procedure code is inconsistent with the patient's age. Correcting these errors and providing additional documentation can help overturn the denial. To succeed, seniors should keep copies of all denial notices and stay on top of appeal deadlines. Using templates and checklists can make the process smoother. Also, seeking help from a Medicare counselor or patient advocate can be very useful. In essence, the secret language of medical coding denials is a set of standardized codes that explain why a claim was denied. Knowing what these codes mean allows seniors and their advocates to respond effectively and increase the chances of getting the services they need approved.